Troubling new data showing that millions of Americans, possibly 12 million, are getting the wrong diagnosis every year, with many facing life-threatening conditions. Joining me now to talk about this story, Dr. Peter Edelstein, patient advocate and chief medical officer for Elsevier. Welcome to the show, Dr. Peter. Good to have you here. Why are so many people being misdiagnosed?
Well, that's the big question here, Jerry, and I think what we have is a perfect storm. We have doctors who are now under intense scrutiny in terms of how much money we spend on each patient, on every test. At the same time, the American population is aging rapidly. There are 10,000 new Medicare patients every day, and these are the folks who have health care issues. And finally, most of us were raised to at least not challenge or question our doctors, and sometimes we even revere them. So you have this combination of economic pressure on physicians and healthcare systems to reduce costs, an aging population of patients who have health needs, and patients in general who don't want to question or push back on their doctors. And the result is a stunning number that 1 out of every 20 Americans who visits their doctor each year is misdiagnosed. And Jerry, half of those, 6 million people, have the potential to suffer serious harm from a delayed or misdiagnosis.
Well, Dr. Peter, that's exactly what I was going to ask you about next. What are the potential consequences from this?
Well, I think we can all appreciate in the extreme examples of you have a lung cancer or a colon cancer or a breast cancer, and you're not diagnosed in a timely fashion. And if you wait 1 week, 2 weeks, that may be okay, but in some of these cases, people are waiting months before the symptoms become so bad that they return to the doctor. Now, waiting a couple months for a cancer is in no one's best interest. We all know cancer tries to spread. The same challenges happen with heart disease, lung disease. Waiting doesn't help. Misdiagnosis doesn't help.
Here's what I don't understand. You said one of the big factors is that there's intense pressure to control costs. So how does that lead to misdiagnosis?
Well, that's a challenging question. There are a lot of subtleties to it. But over the last many years, doctors have really become aware that we're really closely being scrutinized for every healthcare dollar we spend. We're analyzed in terms of how much money do we spend to evaluate and treat disease A versus B. So we're very, very aware of that. At the same time, the population rolls are growing, so we're incredibly busy. And so it may be that we stop and think, well, I don't know if this patient really has something significant. Let's just follow him or her. Nothing like that would ever be intentional. None of us entered medical school to hurt anybody. But there is a lot of scrutiny over how we evaluate patients and how we spend healthcare dollars.
As a matter of fact, there was a story out today showing that some of the trade organizations for specialty docs, like oncology experts, they're being pressured to bring down prices. So, that can change your diagnosis too, right? That can change how you view what somebody has and how you're willing to treat it.
That's exactly right. Healthcare reform is really this yin and yang. There's a great drive to improve quality, but there's also a great drive to reduce cost. And it's much easier to think about reducing cost in my office today than improving quality. It may be not ordering a more expensive test at this time because I'm not really convinced it's necessary. There is a lot of pressure on physicians to reduce costs while delivering better quality. And I think when you look at these numbers, 12 million Americans misdiagnosed, there's cause for concern and pause here.
I agree. I think it's a fascinating study, but you're a patient advocate. What do you tell patients to do about this problem?
Well, I've written a book for patients and their families called Own Your Cancer, a take-charge guide for the recently diagnosed and those who love them. The Own Your Cancer concept can be broadened to say own your health. I remind patients that before they come into my office and put on that silly gown and sit in my cold room, they have owned their lives. They've made decisions about their careers, raising their children, which mortgage to accept, and then they come into my office and they abandon all ownership of their health. So I encourage people to question their doctors respectfully. You can even challenge it. Patients really need to understand that today they have to take responsibility for understanding some basic healthcare questions. And you want to look for a doctor who will be your partner, not the one who tells you everything to do. That means you have to think about who's the right doctor in terms of a personality fit. But the reality is the burden is going to fall back on average Americans to own their healthcare just like they own other aspects of their life.
Well, Dr. Edelstein, thanks for coming on. It's a DIY world out there. We're responsible for everything, our health, our retirement, you name it. Thanks so much. Fascinating conversation. Appreciate your time.
Thank you, Jerry. Appreciate it.